I'm Richard Sherwood, the Director of the Division of Morphological Sciences and Biostatistics within the Lifespan Health Research Center, part of the Boonshoft School of Medicine. We conduct biomedical research with public health relevance. We are primarily a grant-funded research center. When we work with a number of populations, the best known in the area is the Fels Longitudinal Study. We have several main areas of research, which include human growth and development, clinical patient-centered research, research on cardiovascular disease, musculoskeletal health, including bone and joint health, and dynamic motion analysis of human gait, and craniofacial research. Craniofacial disorders are among the most common congenital defects found in humans, with cleft lip and palate being the most common congenital defect, affecting about 1 in 700 births. We don't actually study the genetics of the disorder. What instead we're trying to do is elucidate the basic genetic background that a mutated trait will act in concert with that produces variations in human morphology. And this is a difficult aspect to get at, but one that is extremely important. We do this in 3 populations, the 3 populations I mentioned, because each provides a unique resource for examination of the traits we're interested in. The Nepalese population we're working with is a population which is in a very remote area, does not have ready access to dentists. Almost nobody there has ever received orthodontic treatment of any kind, so the morphology that we identify there, and we're specifically looking in the oral facial region around the mouth and the nose in that area. The variation that you see there is what would be considered normal, and there are problems with bite and things like that, but they haven't been treated, which is very hard to find in a US population. The baboon population we're working with is one which is a very controlled situation where the baboons are fed a diet. They all have kind of the same environmental influences on their craniofacial morphology, but this particular population has been bred specifically for genetic work, which gives us a rare opportunity and a very powerful opportunity to study genes. The population of humans we're using in Southwest Ohio, the Fels Longitudinal Study, is an extremely unique resource in that we have data on families dating back to the 1920s and 30s from Southwest Ohio and continuing on till today. And that gives us a good handle on an American population for which we have lifetimes worth of data and family data that we can explore the genetics of that. One of the biggest pushes being made now in biomedical research is to do research, conduct research with a translational component. That is something that can be taken straight from the research or as directly from the researcher to the patient population as quickly as possible. It's not easy to do, but we've started a research project here that we think will have an impact, and that is we're as we all know, one of the biggest problems in American health these days is obesity. There are a number of ways that people are fighting obesity or compensating for their own obesity through diet, through exercise, and of course, as you see on television these days, there are commercials for bariatric surgery, for various types of stomach tying and gastric bypass. We know that one of the problems with obesity is obese people have impairments to their gait. You can see this in many aspects of it, just the way they carry their knees and the loads that are placed on their feet. What we don't know is how quickly that returns to normal, or if it does return to normal, after the rapid weight loss that's seen in bariatric surgery. If it does return to normal, that's a good thing, obviously, but even what may have happened is you may have sufficient enough damage or sufficient enough change in the way they carry themselves that they maintain problems with their gait, which can be a risk factor for later term disorders such as osteoarthritis. And we're able, with our state-of-the-art motion analysis lab, to examine this and quantify this in a way that nobody has done before. Much of the research here at the Lifespan Health Research Center has focused on an extremely unique resource, and that resource is the Fels Longitudinal Study. The Fels Longitudinal Study began in 1929 and began as a growth study. There were a number of other growth studies that began at the same time, and the idea was very simple. Follow newborn babies, chart how they grow, see what the differences are in how they grow, and see how they turn into young adults. Most of the growth studies at that point terminated when those people achieved adulthood at 18 to 20 years. The Fels Longitudinal Study decided that they wouldn't stop then, and we have continued to follow people that were originally seen actually as fetuses in 1929. Their mothers came in as pregnant young women. The babies were born, and they started being followed from shortly after birth, and now some of those people are coming in as 82-year-olds or 70-year-olds. That is allowed us to do things that nobody else can do, which is to look at early life precursors for late adult onset diseases such as osteoarthritis and osteoporosis. We also, another unique aspect of the Fels Longitudinal Study is that they decided to recruit families. Again, no other study did this at the time, and this was done simply to facilitate getting people in, asking people if they had brothers or sisters to come in. But what it's allowed us to do is to make use of this resource to study the genetics of these disorders that we're interested in, to look at the normal genetic underpinnings for various metric traits. And it gives us a great opportunity to study how an individual changes across the lifespan. When the Fels Research Institute joined the newly formed School of Medicine at Wright State University, now the Boonshoft School of Medicine, it was also marked a period of transition within the research from a period where it was funded primarily from a private foundation, the Fels Foundation, into one that was dependent upon federal funding. And since that time, we've been primarily dependent upon funds from the National Institutes of Health. You're probably, without knowing it, aware of the research that's been conducted here as part of the Fels Longitudinal Study. If you've ever had a small child that you've taken in to your doctor and your doctor tells you that that child is in the 60th or 70th percentile of growth for their age, up until the year about 2000, those growth charts that your doctor was looking at were based almost entirely upon data from the Fels Longitudinal Study. The funds that are brought into Wright State University go not only to fund the researchers conducting the study, but also to fund the data collectors, those people who interact with the participants on a daily basis, who measure the children, and who form an integral part of the mission of the Fels Longitudinal Study. It also goes to fund the data analysts, who deal with the very large databases that we have amassed over the years, and who are tasked with finding new and innovative ways to interpret those data. This means jobs for Wright State University and for the Dayton area. And we as researchers are extremely proud that we are able to contribute both to the scientific mission of the Fels Longitudinal Study, but also to help with the economic growth and health of the Dayton region and Ohio in general.